on another occasion. Thank you.
Kevin Haig.
Thank you very much, Mr. Speaker. It's my pleasure to take a call, and my genuine pleasure to take a call on this debate. I want to begin by thanking our officials from the Ministry of Health, all of those who made submissions. There were some extremely good submissions, and there were some not so good, and also those who gave us advice. And I think particularly about those advisors and officials who we went back to time and again to get it right. This was a long inquiry, and I believe the report that has emerged has been a comprehensive one. There's something about children that perhaps has enabled the extraordinary cross-party approach that we have been able to take in this report. And I think it may be this, that when we consider children up to the age of 3 and think about all of the things that might go wrong in their lives to that point, nothing is ever the fault of those children. And so whichever political party, whichever political philosophy we come from, we are able to agree on the need for us to do things that will make the lives of those children better. And we were able to do so. One of the I guess, abstractions that we made in this report was a recognition that in order to make the lives of those children better, we could not focus solely on services targeting those particular children. We actually also needed to look at almost a life course approach, recognising that the circumstances and the lives of the adults in the lives of those children have a profound effect on those kids. And we also recognised, and it's woven right through this report, the impact of the wider environment, the social environment, the economic environment, the physical environment that those kids live in actually has a profound effect also. We had an interesting approach to building this report of taking particular chapters for each of the members of the committee. And the particular ones that I put effort into were around sexual and reproductive health and around nutrition and obesity-related disease. And I'm certainly proud of those chapters, as I am of the whole report. It seems to me, for example, extraordinary that we have allowed until this point a situation where we know what best practice sexuality education looks like in schools, and yet we have not insisted that all schools implement that best practice education. I think we now are ready to move on. In relation to obesity and obesity prevention, I think one of the things that we learnt through going through this report was something that we remark on in the report, which is that there is no silver bullet that we're aware of anyway. There is no intervention for which there is comprehensive evidence of success. And what that says to us, and I draw on the comments that Dr. Hutchison made in his open contribution in this debate around what Heckman's analysis tells us about the importance of early intervention in the life of a child in order to have the greatest impact. When we become aware of an issue, the sooner we can intervene in that, the better. And what that compels us to in so many of these issues is an understanding that we will not have perfect evidence, but the urgency of the issue compels us to act in the absence of perfect evidence and to gather the evidence as we move on. So we implement great evaluation frameworks around the things that we do. I want to finish by commenting on the extraordinary step of this debate in the House and thank the Business Committee, the extraordinary consensus of the committee, and thank in particular our Chair, Dr. Paul Hutchison, as others have done, because his commitment has enabled an extraordinary result. as we have seen by the universally positive responses of the news media, of the specialists, of the Children's Commissioner to our report. This is a great report, and I look forward to the government implementing it.
Scott Simpson.